Antimicrobial resistance, AMR, poses a significant threat to global health. It's responsible for an alarming 700,000 deaths annually, and projections indicate this number could soar to 10 million each year by 2050. Central to countering this threat is the better use of antibiotics and the crucial role of diagnostic testing in antimicrobial stewardship. But what exactly is antimicrobial stewardship, AMS? Well, AMS embodies a comprehensive strategy that emphasizes the appropriate use of antibiotics. It seeks to ensure that both antibiotics and antimicrobials are used correctly. It seeks to ensure that the right medicine is administered to the right person at the right moment. One of the most effective means to achieve this is through diagnostic testing. The British In Vitro Diagnostic Association, BIVDA, has been at the forefront of advocating for an expanded use of diagnostic tools beyond just laboratory settings. They want diagnostics to be used at crucial touchpoints, such as during triages in A&E departments. Given that a significant 70% of information is derived from diagnostics, this is hugely important. When antibiotics are prescribed and used correctly, they can slow down the spread of drug-resistant pathogens, improving patient outcomes. For critically ill patients suspected of having severe infections like sepsis or meningitis, having prompt access to diagnostic technology can mean the difference between recovery and suffering severe complications or even death due to a delayed diagnosis. One key challenge is the intricate and costly process of developing new antibiotics. Sadly, a good number of these newly developed drugs become ineffective prematurely due to resistances stemming from their misuse, leading to a significant waste of resources. There is a significant gap in our healthcare system between diagnostics and antimicrobial therapeutics, which increases the spread of AMR. There is an urgent need to integrate diagnostic tools at the forefront of healthcare services like the NHS. It's also important to align therapeutic and diagnostic evaluations using companion diagnostics wherever available. The goal is to have a system where diagnostic tests directly inform prescription decisions. The National Institute for Healthcare and Excellence, NICE, supports this strategy, suggesting that diagnostic interventions early in the treatment process should be more widely recognised and adopted. However, there is still need for sustained advocacy, more funding, and the continued application of the strategies identified. Today we are joined by Helen Dent, CEO of BIVDA, to find out more. Helen, thank you so much for joining us today. And given the alarming projections of AMR-related deaths reaching 10 million annually by 2050, what immediate measures do you believe are essential to counter this threat effectively?
Thank you. Since the discovery of penicillin, antibiotics have been the backbone of healthcare as a first-line treatment for bacterial infections and associated sepsis, and as an essential part of the surgery and cancer therapy. Fleming himself flagged the risk of resistance not long after the discovery, yet little has been done to safeguard or prevent this potential catastrophe. In fact, global antibiotic consumption is predicted to increase threefold by 2030. There is a real need to build public awareness in order to instill a behaviour change, increasing understanding that it's not the individual who becomes resistant, it is the bacteria itself, which can then go on to affect more and more people, causing a potential pandemic, resistant to available treatments. We have already seen the potential impact of an infectious disease where at the outset there was no known treatment and prevention options other than isolation. A vital part of addressing this is the use of diagnostics. So infection remains the only disease area where a treatment is often prescribed without a diagnostic. We have the innovation to diagnose the pathogen of disease and to target the treatment accordingly, yet this step remains unutilised. So we must proactively together avoid a situation in which significant resources have been used to create a new class of antimicrobials, for example, only for these medicines to quickly succumb to resistance because we've not been able to efficiently identify or diagnose the type of infection to enable the appropriate treatment. Diagnostics need to be prioritised and utilised across the infection management pathway and funded accordingly.
How does BIVDA propose to expand the use of diagnostic tools beyond traditional laboratory settings?
So as the healthcare sector looks to recover from backlogs through COVID-19, IVDs, which are in vitro diagnostics, are key to alleviating capacity challenges and freeing up resources elsewhere throughout the NHS and the patient pathway. This is especially the case given the predictions for a challenging winter season ahead and with the growing challenge that AMR presents. IVDs help to reduce hospital stays, and they can also empower patients to look after their own health at home, resulting in healthier population and stronger economic growth. We welcomed the greater emphasis placed on diagnostics during the COVID-19 pandemic, and we believe that it's vital for the use of infection diagnostics to be expanded and further embedded within the health system outside of just acute settings, so much more within the community setting. BIVDA are working with members and our overall network to influence the utilisation of diagnostics in community settings, for example, pharmacy. With the proposed launch of common conditions services planned for next year, it is integral that these new pharmacy-led pathways are built for stewardship and appropriate antibiotic prescribing, as well as in other community settings. This is utilising the available diagnostics that we have to deliver the appropriate care for patients.
How do you see this influencing the future of antibiotic prescription and reducing the spread of drug-resistant pathogens?
Yes, so diagnostics can rapidly and accurately identify infections. They can also inform appropriate antimicrobial usage, and therefore this helps reduce the risk of inappropriate treatment, missed or delayed recognition, diagnosis and treatment of either infection or non-infectious diseases, as well as severe sepsis. To deliver long-term solutions to overall infection management, companion diagnostics should be used. This is the drug and the diagnostic together to support the provision of improved care and minimise the growth of drug-resistant pathogens. We have to instill this behaviour change within the healthcare system, one that avoids preferencing cheaper prescription antimicrobials over the more costly diagnostic testing, because this represents poor stewardship and compromises definitive diagnosis and treatment.
What strategies are in place to ensure their effective use of antibiotics?
We've already seen highly effective solutions previously between government and industry through the partnerships for rapid development and rollout of COVID-19 diagnostics and vaccinations. Whilst the UK is currently a world leader in taking an innovative approach to funding antimicrobial therapeutics through its subscription model, approximately less than 1% of the budget is dedicated to the uptake of new and innovative IVD products. These advances in approaches to therapeutic innovations need also to be matched by an equal willingness to innovate in the funding of diagnostics.
How does BIVDA aim to align diagnostic evaluations with therapeutic strategies, ensuring that diagnostic tests directly guide prescription decisions?
To fully benefit from the advances made in the development and responsible provision of antimicrobials, therapeutics need to be paired with advanced and now widely available diagnostics. To deliver long-term solutions to infection management, the appraisal of therapeutics and diagnostics must be done together. They have to be considered in tandem. Currently, the NHS England MedTech funding mandate policy demonstrates an innovative approach to supporting commissioners and providers to use cost-saving diagnostics through a reimbursement model which incentivises their use. However, mandatory funding should be made available to all diagnostics, including those which may not be cost-saving in year one, but would otherwise deliver a significant system benefit to the population and potential cost savings in the longer term. This approach should be fostered and capitalised on specifically for infection management more widely.
How does BIVDA advocate for greater awareness, more funding, and the real-world implementation of agreed-upon strategies?
We have a team at BIVDA that is constantly engaging with NHS England, NHS Improvement, NICE, MHRA, Government, Parliament and the Civil Service about all the key challenges and opportunities facing the industry. This work involves distribution and development of policy briefings. We provide evidence to parliamentary select committees. We respond to government consultations, and we facilitate communications between BIVDA member and industry and the policy makers, and make sure that we are able to provide information and updates about the IVD industry. And at the heart of all of this work lies an ambition for us to improve the patient outcomes by increasing the adoption of IVDs early within the NHS.
And where can listeners go for more information?
There's our website, which is www.bivda.org.uk. There is a plethora of information available on AMR, particularly the Infection Management Coalition have produced a white paper which sets out a bold vision for improved surveillance, prevention, screening, diagnosis and management and reporting of infection. This is available at www.theimc.org. And with resources available online from obviously the NHS, there is the UK Sepsis Trust, there's BSAC, Antibiotic Research UK, all of which are well worth a read. What we need now is a collaborative action, and this is an issue that is not going to go away. So government, industry, providers, academia and the public all need to work together to implement action.
Helen Dent, CEO of the British In Vitro Diagnostic Association, BIVDA. Thank you so much for joining us today.